Sure.
Right.
So just for purposes of recording this, I'm going to repeat the question so that we catch it on the mic. Your question was, have we seen any complications? Post-delivery in vaccinated women.
Or patients with COVID. I mean, I think I think that becomes part of the problem with the question. Okay, the problem is that patients with COVID, higher rates of preterm deliveries, higher rates of C-sections, higher rates of intrauterine fetal growth restriction, higher rates of hypertension and preeclampsia. We're seeing that with COVID patients. Those are all real morbidities that will equate to a change in mortalities when they end up getting presented. So there is a COVID arm that's going to have these complications. We haven't seen it, they haven't published any data for vaccinated patients with pregnancy complications. Anecdotally, it's hard when you have, what happens in practice is that you start to look back at the patient and what did they have during their care when they have a complication, whether it's preeclampsia, whether it's preterm delivery, whether it's growth restriction. And so when you start to trace back what happened over the course of that patient's prenatal care, yeah, there's going to be some patients that had COVID vaccine while they were pregnant. What we're going to have a hard time doing, at least in the short term, is trying to separate those patients out from what is the natural number and is there a change from the COVID number. Now, it's going to come out, right? It's going to be apparent at some point, but it's going to be at least 9 months down the road, but more like 12 to 15 months just because of the nature of pregnancy, right? But when it comes out, there's going to be a lot of data to look at. Because even if you're talking about 20% of pregnant patients getting vaccinated, well, we already know that number is going to be astronomical in terms of research numbers, in terms of data numbers. I mean, you have to remember, a lot of times the way we use studies and the way we give medications before we make predictions, those numbers of patients that are used are actually not that big in comparison to what we're administrating as a vaccination. So we're going to have a lot of data. Anecdotally, yeah, I mean, I'm not seeing it in the practice, but look, we deliver 150, 180 patients a month, and we've only been giving the vaccine to patients that are, pregnant patients have been getting it since maybe April, May. So I just I don't have anything to offer, and neither does the CDC. And I'll tell you, there's an interesting thing, a lot of times, in medicine, especially some of the subspecialties, that there is a study that's going on out there, and you get these kind of preliminary reports that you talk to your patients about, like, hey, look, I think this is going to happen. It's going to change the way that we do medicine. Everyone's going to see the same data that we see at the same time. That's what's so unique about this whole situation, is that I'm not getting information a year before it's coming out and being presented to the population. In fact, honestly, I've had a couple times patients have said things to me, and I'm like, well, because I've been in the office all day, they've already seen it on the news. So it's all happening in real time, and that's why the questions, and answers are sometimes hard, and why they change, why it evolves, right?
Either of the ID doctors want to weigh in on that, or you both feel comfortable with Dr. Johnson?
No, I have to say that's a very detailed and logical explanation of everything. Are you also going to address infertility, or do you want me to talk a little bit about that?
We can go down the list of, I have 31 questions to go down.
Okay, so when the question comes about that, I can talk about the infertility issues.
Okay.